My name is Barry Beyer. I'm a medical doctor and the executive director of the Virginia Hospital Center Medical Brigade. The brigade started out as a 1 week a year, once a year, responder to a national emergency or to a national disaster. And that disaster was Hurricane Mitch. We have now evolved into a 52 week a year operation. We make 10 to 12 trips a year. We have ongoing projects that are high impact and sustainable in mountain areas and in the work we do in the city of Comayagua. At the current time, we really have two components to our work. We have a really large trip every November. We're between 60 and 75. I think we've had as many as 80 people, mainly healthcare professionals, come to Honduras. We do surgery at 2 hospitals. We do physical therapy, recycled eyeglasses, public health education. We've got a lot of stuff going on. And we really, I think, make a difference in people's lives. We try to do the kinds of things that provide the services that make a difference in people's lives, things that are not available to the population that we serve. And we serve many of the poorest people in the community, some of whom are the poorest of the poor. At St. Teresa Hospital, we are now doing general surgery and doing gynecologic surgery. So we're doing both laparoscopic general surgery and open surgery. We have expert surgeons, operating room nurses, recovery room people, anesthesiologists, nurse anesthetists. We have quality healthcare providers coming from the United States who provide the same level of care with the same professionalism and compassion as they do to our patients in the United States. At SBJ Hospital, we are doing urologic surgery, pediatric eye surgery, and gynecologic surgery. The pediatric eye surgery, in addition to, we do a number of pediatric eye procedures, but primarily children with crossed eyes. So this has both physical parts to it and emotional or psychological, in that a child with crossed eyes, it's really a very significant disability. Our surgeons can correct this in 30 minutes approximately. Eyes go from crossed to straight. To me, it's like a miracle. It's very dramatic and life-changing. Our urologist, we do urologic surgery there. Our urologist does a number of different kinds of procedures. One of the most dramatic and life-changing are the procedures on men with an enlarged prostate who are completely obstructed and require a urinary catheter to manage that condition. Otherwise, they couldn't live, they wouldn't survive. And this procedure takes a little longer. It takes an hour or maybe a little bit longer, but then the men become catheter-free. So some men who have had a urinary catheter in for 2 years, 5 years, one man had it for 12 years where it was just changed. It was managed by being changed every 2 weeks. He's now catheter-free. So, I mean, the joy that these patients have after surgery is enormous. And we, as the healthcare team providing those services, of course, we find that very gratifying. And it has us coming back year after year because of the kind of impact we see that we're having. We send a very talented therapy team to CRIC. These are physical therapists, occupational therapists, pediatric physical therapists that go there and train the physical therapists in newer techniques, train them in areas maybe they haven't been trained in, and new procedures that can help a variety of conditions. We felt this was much more impactful than sending our team to do physical therapy services, which would be like one time on a patient and give them a handout and then leave. We felt it'd be much more impactful to train. So our therapists are more now like trainers and consultants. And we find that role much more satisfying and gratifying and feel we really are making a difference in the flow at the physical therapy procedure and the kinds of outcomes that they're having there with their patients. All the services that we provide, I think, really make a difference in people's lives. The eye team services are no exception. We have a large eye team. It includes an ophthalmologist, an optometrist, opticians. They're quality people that know their field and provide general ophthalmology services and also recycled eyeglasses. The recycled eyeglasses are, we're told by those that provide the recycled eyeglasses to us, which is the Lions Club in the United States of America. They have an eyeglass recycling program, that we are one of the largest and most highly professional groups that they work with, because we have very large number of eye care professionals. These eyeglasses make an enormous difference in people's lives. I don't know what percent of the population wears glasses in different countries, but it's a significant number. If you need them and don't have them, your quality of your life is very significantly downgraded. These glasses are a very big deal. We provide them to men, women, children, and they can read, they can sew again, they can do their accounting, the children can see the blackboard. There are all sorts of obvious advantages to sharp vision. So that team, in the course of a week, we're here and they work 6 days. They provide these eyeglasses for over 3,000 people. So they're very productive, they're very busy, and they're making a great difference in people's lives. Another team that makes a big difference is more of an educational difference. We have a public health education team that accompanies the eye team. The eye team and the public education team travel together, and they go to 6 different communities during the 7 days that we are here. The public health education team gives people teaching in areas that are basic, very important, but many of the people that they are lecturing and interacting with, it's more than just a lecture. It's really a very personal interaction in groups of 15 to 20. Haven't heard some of this information before. We try to make it as exciting as possible, sort of entertain them, and then give them a toothbrush, personal care items, combs, floss, soap, toys. We have all sorts of things to get them enrolled in the conversation and to try to impress them with how important these public health or health concepts are. Our Remote Village project has 2 major components to it. One is our community health workers, which work in 3 clinics, 2 of which we've built in remote villages. We have currently 15 community health workers that we have trained. We provide continuing education and monitoring every 3 months. We send a team to Honduras that works with them, goes over all their patient cards, provides education in areas where they think it's necessary, maybe provide them with even new skills that they might have, that we might think are important for them to have at this time. The other part of our project in the villages has to do with water, potable water, sanitation, and smokeless stoves. We also do community health projects or community education on public health issues. Things that might be second nature to many, but for the people in the remote villages, many of the things that we talk about and explain to them are things they've never heard before. Our water project serves over 10 communities, over 5,000 people. Hundreds and hundreds of homes are served by the potable water. And the way we do it, we bring the water in pipes to each home. It's piped in with spigots. One goes near food preparation or food for that purpose. It's near where they prepare their food. The other goes near the latrine. We provide them all with a latrine and rocks to build a small septic system. This is right outside the back of their home. They then have something they've never had before, which is a latrine. They build a little privacy area and they have a spigot right there where they can fill up a bucket and flush the latrine. Another component are the smokeless stoves. We've installed hundreds of these smokeless stoves. Many homes, when we first showed up in these communities, all the homes, the food is cooked on open fires in their homes. The homes are full of smoke. They're like a smokehouse. Many of the people that live in these houses have eye issues, nasal issues, sinus issues, respiratory problems. They cough, asthma. People that don't have asthma end up with significant respiratory symptoms. The smokeless stoves make a huge difference. We've studied it carefully. We've done pulmonary function tests before installation of the smokeless stoves and then 6 months after the installation of the smokeless stoves, and can see really very significant difference in people's lung function. I've been frequently asked why I do this work or why the other team members come back and do this year after year. And I think it's clearly because we see that we're making such a big difference in people's lives. But when we talk amongst ourselves, there's no question, and we look at others of our team members, there's no question that many of us are changed. That we come to help others and we walk away or come away from this as changed people. And I think it's always for the better. This is like one of the most gratifying experiences for me personally. And if any of you are interested in volunteering, or if you have any in-kind items that you think could be useful to us and want to let us know about that, or if you wanted to make a financial donation to help support this work, because we try to get as many things as we can in kind and get it for free, but there are many things that we have to purchase, including paying for our container that we ship here every year. Please go to our website, which is www.vhcmedicalbrigade.org, and you can get all sorts of information about what we do and how to connect with us and get involved in any way that you might want to. Thank you very much.